Good evening. It looks, according to my watch, as 6 o'clock. I'm sure we'll have some folks join, and I'm not the most important part of this, so we're going to get this webinar started. I want to say good evening and thank you and welcome to PSR's first webinar. I'm Dr. Cory Carroll, chair of PSR Colorado and a family physician in private practice in Fort Collins. I've been doing this almost 30 years. I imagine, but most of you may not know, that National PSR has been in existence since 1961, almost 60 years, focused mainly on the nuclear concerns, but they work to protect human life from the greatest threats to health and survival. The current chapter of PSR Colorado was formed just about a year ago, not anywhere near the length as national. And this occurred after a group of activists put on a medical symposium discussing the hazards from oil and gas activity in Colorado. I want to read our chapter's mission. It is to elevate the voice of health professionals to protect the public from the health impacts of hydraulic fracturing, the climate crisis, and exposures to radionuclides and other toxic substances on current and future generations. PSR Colorado advocates for solutions to reliance on fossil fuels and nuclear energy. Tonight's webinar is in line with our mission statement to educate and advocate. When we think of environmental pollution, I'm pretty sure most of us imagine the outdoors. Even today, Colorado's air is impacted tremendously from the ongoing fires. But before the fire started, we definitely had a problem with air pollution, especially ozone. We are coming up to a year after the EPA downgraded the Front Range's ozone to a serious non-attainment rating. But that's a topic for another webinar. What tonight's webinar will hopefully create is the inclusion of indoor air when we think of pollution, in some cases more dangerous than outdoor air. Most appliances in American homes burn gas, and that combustion, combined with poor ventilation and some leakages here and there, contributes to indoor air pollution. Even though medical school was a long time ago for me, I'm hard-pressed to think of one lecture discussing the concept that our indoor environments can adversely affect health. I think many healthcare workers have a void in their educational experiences as well. Tonight, we will explore how our home environment matters. If you're in the healthcare world, tonight's webinar will hopefully get you to ask about the home environment and educate your patients, clients, on the harms of gas-burning appliances. Also, learn how to mitigate the risk. Now to specifics for this webinar. To minimize any distraction, all participants will remain muted and their webcams will be turned off. You should have a control panel on the right-hand screen, wherever it is on your screen. To view or collapse the control panel, use the orange arrow. Hopefully, you're seeing the video and hearing the audio without difficulties. But if you are having problems, you can type a note in the chat pane and send it to the meeting organizer. To ask a question, please type it into the question pane that's in the control panel. We will be monitoring your questions and read them to the presenters when they're finished. If we run out of time there are unanswered questions, we will do our best to post the questions and answers on the PSR website once completed. Okay, let's get this webinar going. Tonight's panelists are both pediatricians and, as such, care of a subset of humans that are more vulnerable to air pollution. To start us off, we have the Honorable Dr. Yadira Caraveo. In addition to her busy pediatric practice, she represents House District 31 in the Colorado Legislature, and that encompasses Thornton. She has an incredible resume, and I don't want to take time from her talk or Dr. Miller's talk, but I did want to hit one topic that I think was quite profound. She was working with the Union of Concerned Scientists in Washington, D.C. around the same issues that she's dealing with now in the legislature and many others, but the effects of climate change. And in recognition of this advocacy, she was honored by the Obama White House as a champion of change in 2013. With that, I'm going to let Dr. Caraveo give her talk.
Well, hello, Dr. Carroll, and thank you very much for your kind words and for all of the work that PSR does around issues like these. I think that I'm completely aligned, as you were reading your mission statement, with the work that you've been doing, because a lot of my advocacy, as you said, when I was a budding pediatrician still in residency, started around the issues of climate change, air pollution, and how those affect breathing issues in children. And I had the honor because of that, of getting to go to the Obama White House twice to talk about coal burning power plants and what they were doing, in particular in New Mexico, where I did my training, to children's health and in particular to asthma rates. And since that time, my advocacy has only grown to the point where I was convinced to run for office and am now the only physician serving in the Colorado state legislature. I'm finishing up my second year in the legislature. But when I'm not there, I do continue to be a practicing pediatrician. And so as a pediatrician, and I think as any physician in any specialty, we have become very accustomed to the issue of asthma and respiratory issues, especially in children. You know, so accustomed sometimes that they can seem mundane, and we don't necessarily think about the issues that have led to asthma, that have led to an increase in allergy and atopy overall, and that lead really to asthma flares so much of the time. You know, in pediatrics, there are a few chronic conditions that we take care of. Asthma is one of the main ones. We see a little bit of diabetes, but not a whole lot. And then we see some mental health issues where we do regular med checks. And like any condition that a doctor takes care of over and over again, I think sometimes it's hard to delve into the deeper issues surrounding that health condition. But with asthma, these can be very multifaceted and an issue that we're still learning a lot about. As was said, I started a lot of my advocacy around the issues of oil and gas exploration. And I often say that this didn't become as big of an issue when it was affecting only brown and black populations in areas like Elyria, Swansea, or Commerce City, but became a much more vocal and recognized issue once it kind of came into areas like the areas that I represent now that are being fracked. And that is something that as doctors, it's easy for us to kind of pick up on because we can look out office windows like the one in my clinic. And when we fail to see the mountains, we know what the air quality looks like. And they're easy to focus on because air pollution and air quality have been something that we've been talking about for some time now, even though we haven't been very proactive in solving that issue. And the legislature concentrates on issues like that just as easily as doctors do. I had the honor in my first year as a legislator to be able to co-sponsor along with Speaker of the House, Casey Becker, who represents areas of Boulder, Senate Bill 181, which really reestablished how Colorado looks at oil and gas exploration, not just as a rubber stamp saying every application that gets put in gets approved and we continue exploration to foster that business in Colorado, but really we need to stop and take a look at the health and safety impacts that this exploration has. And we're just now seeing the rule making happening at the Colorado Oil and Gas Commission to look at how are we affecting health in Colorado, and do we need to stop fostering an industry that is harming our health every single day? But this has been an issue that as a Latina has mattered to me for quite some time because it has disproportionately affected people like me. You know, when I grew up until I was in third grade, I grew up in the Swansea area and where we were down near Suncor. And for any of you who have been following the news at all in the last year or so, we have, just like we have at the legislature, they are guilty of constantly spewing things into the air with uncontrolled emissions that greatly affect health. But a lot of times in clinic, like I said, we don't necessarily think of those things as pediatricians. An asthma flare is an asthma flare, and we make sure to take care of the symptoms, get some nebulizers going, decide whether they're going to need oral steroids, make sure that we're properly controlling their symptoms long term, and make sure that we have them on the right medications, and then we go on with it. And I had, I remember last year after passing 181, an incredible interaction with a mom who it brought in her 10-year-old with a new episode of wheezing, had never had allergies, had never had eczema growing up. Nobody in the family had these issues. And so we were all kind of scratching our heads saying, how is it that this 10-year-old has, for the first time ever in his life, started wheezing? And as I was, kind of, going through the typical list, the mom stopped me and said, hey, do you think that this might be because of the air quality? And that was at a time last summer when we had been hitting many, many days of bad ozone levels, and air pollution was very much in focus last year in the news. And I had to stop and say, you know what, I think that you're exactly right. I think it's definitely something around the air that is affecting him. But like I said, it's easy to focus on outdoor air pollution and outdoor air quality without really realizing that a lot of times the quality of our air inside the house, inside our dwellings, is just as bad, if not worse, than the air that we, take for granted or focus on outside. And I will have to admit that as a pediatrician, it was something that, even though I had focused on issues around respiratory disease and air quality, I didn't know a whole lot about until I started delving into it for this talk. So I know that my fellow pediatrician is going to have an incredible presentation on the real details of that, is, I think, going to be really eye-opening for a lot of members of the audience. But it's something that we need to focus on as physicians, learning about the environmental issues that really affect the health of our patients, and talking to them about it. I think that we have gotten much more comfortable with talking about air pollution, but that's not something that I think every single pediatrician or every single doctor knows about or talks to their patients about. I know that with my involvement through groups who talk about fracking, that's not necessarily something that doctors know about. And every once in a while, we'll have a patient that comes in and says, they just put a well in next to our house, and now my kid's got headaches and nosebleeds and poor, and fatigue and trouble breathing. And that's a lot of times how a physician gets involved in thinking about these issues. But it's something that I certainly didn't learn about in medical school, just like Dr. Carroll, and that we really need to spread the word on, because the impact of indoor air pollution through appliances that use gas, through water heaters, and even through gas burning stoves is something that I don't think many of us realize will increase rates of asthma and only make these flares that come into our offices more common. And it's something that certainly the legislature has not been focusing on, and that I think we're going to have to learn more and more about as the outdoor air quality continues to deteriorate, and we need to make sure that we have as few exposures to pollutants and respiratory irritants as possible. I think that doctors' involvement in groups like these is incredibly important to elevate these issues, because we are an incredibly trusted resource. I've seen that down in the Capitol when, as a freshman legislator, people were coming up to me and asking me how to vote on healthcare legislation. But we see it every single day in clinic. When we have patients who really value our opinions and who really understand the amount of training that we've gotten to be talking to them and advocating for them. And so I certainly encourage you all to learn more about these issues. This is certainly an incredible start to an education around the issues of indoor air pollution, but then also to get involved with advocacy. We all, I think, started our careers in medicine knowing that medicine is a calling. It's not a 9-to-5 job. And a lot of that calling has to do with advocating for our patients, not just when we're in front of them, but outside of that setting as well. Whether you join groups like this who are going to spread educational efforts, both for physicians and patients, or whether you send an email or make a call to your legislator, your congressperson, your senator, your governor. Those are incredibly important issues to make light, to bring to light, and to let your legislators know that you are focusing on, because you're taking care of kiddos or adults every day who are suffering the impacts of things that should be healthy, like the air that we breathe every single day. And so I'm happy to take questions. And then unfortunately, I will have to hop off here in about 15 minutes for yet another meeting. But thank you all so much for your involvement in this, and thank you in particular to Physicians for Social Responsibility for bringing these issues up and making sure that the public is learning more about them.
Wow, thank you very much, Dr. Caraveo. The question box, hopefully people have a understanding. You got to open the little pane and type your questions in. I want to ask you, how the heck can you be a pediatrician and a legislator and be an advocate with everything? I just have a tough time trying to be a doctor and volunteer every now and again with PSR, but I want to thank you so much for that work. And I think as we saw on the slide, you are the only physician at the legislature, correct?
I am, yes. There's a veterinarian who's coming this year, probably, and so that'll be interesting. And then there's a nurse and a pharmacist and a former EMT, but I'm the only doctor. And there need to be more of us. It's tough, I won't lie, just like it's tough handling any kind of thing that you add on to your clinical duties. It's a balancing act, and I'm lucky that I practice at a clinic with an incredible boss who knows that this is just a direct extension of what I would be doing in clinic, just in a different vein. But it requires a lot of flexibility. I'm taking meetings all throughout the day, and then conveniently, he says, taking January through May off, which is to be at the state capitol, which just happens to be the height of respiratory season and our busiest season. But we need to give more flexibility to our colleagues who are interested in advocacy, who are interested in participating in policy, because those legislators at the Capitol are going to be making decisions about our practice and about our patients every single day, whether we're there or not. And believe me, they don't understand healthcare. When I have to explain to them things as simple as what an actual fever is around coronavirus precautions, and yet they're making decisions around how to fund Medicaid and how to do public health responses. We need to be down there. And so I'm been very lucky that my career has developed in a way where I've had the flexibility to be able to participate in this.
Great. I believe the last physician was Senator Aguilar, if I'm not. So it looks like the women docs are taking the lead at helping the Colorado legislator understand this. Do you think, because I like what you were talking about with the question or the question of your patients. We're all overwhelmed with these medical records, and wouldn't it be kind of, as long as we pay attention to it, have a place there where we could identify, where they live? And wouldn't it be also nice to have that? Because I used to live in Aurora, and driving by Suncor, and I'm 60 years old. I remember when I was 16 getting almost nauseated just driving by that, and knowing that somebody's living close to that facility or what their appliances are. I think that should be almost a mandatory question, as you point out, that physicians should ask.
I think I think that's a great point. I mean, EHR certainly has its pluses and its minuses, right? But the one good thing is that sometimes there can be standardization in there that remind us about different things to order or to talk about. I know that in a busy practice, when you've got 10, 15 minutes to get through an appointment, there are certainly things that I sometimes would forget if it weren't for something that would come up. And you know, the computer could probably do it on its own by just kind of tagging an area that is prone to poor air quality, or even notifying you about a poor air quality day, so that you can really be cognizant of, oh, maybe there's going to be a few more asthma flares today, or maybe I should ask about what exposures are.
Yeah, and there was one question that Lori provided, but I'm gonna save that for Jessica because I think it's a little more in her talk. But I'm gonna let you get on. But I have one example of a patient with fairly severe asthma, and I never really put it together, but he said, you know, Doc, every time I leave Fort Collins and go visit my family in Wisconsin, I don't need my rescue inhaler. You know, he's using a steroid inhaler. And I gave him a peak flow, and I said, you know what, when you get over there, and lo and behold, leaving Fort Collins, a couple of days, peak flow comes up, no rescue inhaler comes back, and I believe it's the ozone. You know, this is that part of like a light went on saying, oh my God, all my asthma patients, I have to figure this out.
Exactly.
Well,
and it's exactly the stories that we need, Dr. Carroll, to convince people that we're seeing this every day.
Yeah. Well, I thank you so very much. I know you're got a busy day. I'm going to quickly, just one question though. What kind of legislation is being done about moving away from gas in new construction? Any quick summary on that?
We definitely are doing more things about incentivizing renewables when there's new construction. But, you know, as you're about to learn, a lot of the energy that we consume has to do with buildings. So it's certainly something that we need to concentrate more on. Over the last couple of years, we've been really looking a lot more at air quality standards and oil and gas exploration. But we certainly have a group of legislators that's been kind of slowly but surely trying to increase efficiency and the use of renewables, especially around new building.
Great. Well, I thank you, and I'm going to let you get on with your busy day. And again, gratitude from all of us for your work at the Capitol.
Oh, thank you. Thank you so much for what you're doing. You groups like yours prop our efforts up at the legislature every day. So thank you very much, and have a good night, everybody.
Good night. Well, I'm going to move right along and introduce our next speaker, and that is going to be Jessica Miller. And I'm trying to do so many things here. It's kind of fun, but at the same time, a bit difficult. So Jessica is a general pediatrician who has been practicing in Colorado for the past 5 years since finishing her residency. She just started a new job and is down in Durango. She began volunteering for PSR this past year with the desire to learn more about and advocate for environmental health issues that affect the health of our planet and her patients. So Jessica, I am going to let you go, and we have a slide set to show the audience, and you're all on.
All right. Well, hello everyone, and thank you for joining us. And that was a great piece by Yadira. So I'm happy to be able to follow that up. So so Cory, I will ask you to advance to our next slide. All right, so today we are going to focus on indoor sources of pollutants, which really is an important issue. We know that in the United States, we are estimated to spend about 90% of our time actually indoors. So thinking about, you know, what could be affecting our health in this area really is very important. So this graphic is kind of, you know, showing various sources of combustion pollutants that can come from just general appliances in our homes. So most commonly that being stoves, gas water heaters, and gas furnaces. Next slide. So these are a few of the pollutants that are released into our homes as a byproduct of combustion. In this talk, we're going to go through some details about each of them, as well as give some information about how they might be affecting our health. Next slide. All right, so I wanted to start just by talking about kind of cooking in general in the home. And we know that, when we cook in the home, there are pollutants released regardless of what kind of cooking we do. But if we are cooking with gas, we get those additional pollutants that are byproducts of combustion that are released. So if you're cooking on, an electric or induction range, certainly just cooking the food, potentially burning the food, you're going to release particulate matter, so PM10, PM2.5 particles, also ultrafine particles, and some volatile organic compounds. If you're cooking with gas, you're going to release higher levels of PM2.5, but additionally nitrogen oxides, nitrogen dioxide, carbon monoxide, formaldehyde, and more volatile organic compounds. Next slide. So first, we'll talk about particulate matter. So I feel like we've been hearing about particulate matter, especially in terms of outdoor air pollution, a little bit more recently. There was a big study that came out earlier in the spring that looked at increased rates of mortality from coronavirus associated with people living in areas that had higher levels of particulate matter pollution. And then, of course, with all the recent wildfires in the West, I think we've been hearing about and thinking about the health effects of these barn particles in the outdoor setting. And what we do know is that, there's some suggestions that exposure in the indoor air setting may actually be more harmful to our health than when we're exposed in the outdoors. So the larger these two particles is PM10, still very small, being about 10 micrometers in diameter. And then the smaller is PM2.5, being 2.5 micrometers in diameter. And the PM2.5 particles are really small enough that not only do they get into our lungs when we breathe, but they can really penetrate into the bloodstream by passing through the small capillary beds in our lungs. And we know that, although there's going to be some of this around in your home regardless, we know that the levels are going to be higher if a gas stove is used in the home or other gas appliances. So there are a number of associated health effects. We know that there are higher rates of asthma, heart attacks, strokes, hospitalizations when people are exposed to higher levels of PM2.5. There's also been some suggestion that long-term exposure to small particles in children is actually associated with decreased lung growth. And then when pregnant women are exposed to particulate matter, there's some evidence suggesting that there may be higher rates of preterm birth, higher levels of infant mortality, and higher rates of low birth weight. All right, next slide. So carbon monoxide is another byproduct of combustion. So this is one that probably most people are at least somewhat familiar with. There has been kind of increased awareness about the dangers of carbon monoxide. There is, legislation in Colorado as well as many other states mandating that, homes that have, either a wood burning fireplace or gas appliances do have carbon monoxide detectors. And there's, significant health risks associated with exposure. So we know that at lower levels, people can have symptoms like fatigue, nausea, dizziness, headaches. At higher levels, it can really lead people to be pretty disoriented, unconscious, and even lead to death. So carbon monoxide poisoning remains one of the leading causes of non-accidental death in this country, or of accidental death in this country, by poisoning. Estimated about somewhere between 400 and 500 people die every year from carbon monoxide poisoning, and about 170 of those are thought to be from non-motorized vehicle emissions, so potentially exposures that could come from using gas in the home or in industry. So, and then I did just kind of want to point out this chart that kind of goes into detail about, you know, what levels are carbon monoxide detectors really going to alarm. And, you know, although the World Health Organization has set a guideline of upper limit of exposure being about 6 parts per million over a 24-hour period, most carbon monoxide alarms are not going to go off, you know, unless at a level less than 30, unless that level is really maintained for a long period of time, so about a month. Levels of greater than 70, alarms will go off after several hours, and above 70, most people will kind of start to have some of those more vague symptoms we talked about, kind of the headache, dizziness, disorientation, and then higher levels into the hundreds. That's really where alarms will go off relatively quickly at those levels, and where we really get into the more dangerous kind of loss of consciousness and death risks. All right, next slide. All right, so next, nitrogen dioxide. So this is regulated by the EPA, and so there's really a fair amount of research on health effects of nitrogen dioxide, especially when it comes to respiratory issues. So there's been enough studies over many years that the US EPA has come out and stated that long-term exposures are linked to the development of asthma in children. We also know that kind of spikes in nitrogen dioxide can really lead to exacerbations of asthma for children, and also exacerbations of other respiratory conditions in adults as well. There is certainly concern that nitrogen dioxide may be related to cardiovascular disease, diabetes, cancer, reproductive difficulties, and developmental effects such as kind of difficulty with focusing or ADHD. There's not as much evidence around those issues, but certainly kind of some studies suggesting that there really may be cause for concern in those areas as well. And then, you know, I just wanted to point out, so the United States actually doesn't have, you know, a safe upper limit of nitrogen dioxide established. The World Health, for indoor sources, we do for outdoor sources, but not indoors. The World Health Organization has set that level at about 100. Canada has a slightly more stringent level at 90. And you can see kind of in this chart to the right that just kind of normal household activities like frying bacon, boiling water, kind of just cooking on a stovetop, you know, at least intermittently are going to bring levels of nitrogen dioxide into the hundreds in the home. So certainly above that, that kind of established threshold. Next slide. All right, and I think that Yadira commented on this some, but certainly we know that kids are just more susceptible to pollution just because of their physiology. And, you know, they just breathe faster. And then they do tend to be just more active in the home and kind of further increasing their exposure in that manner. They also have a higher surface area, lung surface area to weight ratio. So again, just meaning that anything they're breathing in is just going to potentially have greater effects on them. And then we know that, you know, children's lungs and immune systems are really continuing to develop through the first few years of childhood. So, you know, like we talked about with that exposure to nitrogen dioxide and asthma, really we may be kind of changing the way that that children's systems are developing. And then this quote here, fossil fuel combustion byproducts are the world's most significant threat to children's health and future, and are major contributors to global inequity and environmental injustice. I think is just kind of also hitting on the fact that, you know, as we are using gas in our homes or industrial buildings, we're additionally contributing to climate change, which, poses many health effects for children in the years to come. Okay, next slide. And, like many environmental health issues, indoor air pollution also does tend to affect lower income communities disproportionately. So we know that in general, indoor air pollution levels are higher in smaller homes. Low-income housing and rental housing may also be more likely not to have good maintenance of gas stoves and furnaces and water heaters, or may just not have adequate ventilation, kind of increasing those levels further. We also know that, lower income communities are more likely to be located next to industry or next to big highways. And so you kind of have this compounding effect of higher levels of outdoor air pollution combined with higher levels of indoor air pollution that can really affect people's health. And then, we'll talk about some programs that can help people improve the air quality in their homes. That being said, we certainly need more of these programs, both in Colorado and nationally. So to, allow especially lower income communities the ability to kind of change their indoor environment. Next slide. And these are just a couple studies, focusing on the effects of, using gas in the home for low-income communities and children's health. So this first study looked at, inner city preschool children and kind of measured both nitrogen dioxide levels as well as, a numeric asthma score, and found that really kind of their incremental increases in the level of nitrogen dioxide contributed to, or kind of was associated with incremental increases in the asthma scores that these kids were getting in terms of numbers of days of coughing and wheezing symptoms. And then there's also been other studies like this second one that has looked at the effect of multifamily housing on, both concentrations of indoor air pollution and asthma symptoms, and both seem to be higher in multifamily housing as opposed to single family housing. Next slide. And this slide is, again, kind of just to remind us, we've been talking a lot about like the direct effects of, inhaling these pollutants in our home. But, if we are using gas in homes and industrial buildings, we're contributing to greenhouse gas emissions and ultimately furthering the problem of climate change. Next slide. And then these are just a few gas leaks that occurred in the Denver metro area over the past few years. These are ones that were serious enough to merit a fire department response, and there likely were many others. There's just not a robust system in place to monitor it. And so, anytime we're using gas, there's the potential for leaks, which, is another source of greenhouse gas emissions, of course, and then also is just a fire hazard in terms of being an explosion risk. Okay, next slide. All right, so now we're going to switch to starting to talk about, what can we do about this issue? First thing that may come to mind is, improving ventilation, which certainly is a spot to start. But there certainly are some challenges with just using ventilation to improve indoor air quality when we're using gas in the home. So we know that if the ventilation is installed correctly, maintained correctly, and operated correctly, certainly it can kind of decrease health risks associated with using gas. But there's a lot of barriers to all of those things working well. So, with cooking, we know that if there's an exhaust hood, oftentimes it's just not installed properly, or it doesn't necessarily vent outdoors. So it may kind of recirculate through a filter that also needs to be changed out and may not be like regularly changed out or replaced as often as it needs to be. We also know that kind of the performance of gas hoods vary a lot, and also vary based on like where people are cooking on the stove. So cooking on a front burner, the hood really may not work very well at all, as opposed to cooking on a back burner where it might work better. Those kinds of hoods are also not always used consistently. Either people forget to turn them on, or they're just noisy, so they're a little bit cumbersome to use. And another issue is that just as we do try to increase energy efficiency in homes, sometimes we do that at a sacrifice of ventilation if appropriate ventilation isn't installed at the same time. So kind of another factor that just makes reliably relying on ventilation to mitigate that risk of gas a difficult thing to do. Another option is to change to different types of appliances and different types of cooking. So in terms of cooking, electric and induction cooking, kind of going back to that first slide, although we're going to have some pollutants, we're really going to decrease those or eliminate those pollutants that are associated with combustion. So we know that the levels of nitrogen dioxide in homes that have an electric or induction stove are going to be a lot lower than in a home with a gas stove. We also, induction cooking, I'm just learning about. So for those of you who are maybe not familiar, basically it's a method where it uses magnetic energy to actually just heat the pot or the pan itself. So this is a graphic of just like a single burner induction cooktop. And an advantage of that is that the cooktop really doesn't get hot with that. It's just the pot or the pan that gets hot. So another kind of safety benefit for families for families with younger kids. Also, people do tend to like induction cooking pretty well. I know people feel like gas performs really well in terms of cooking. I think induction cooking is actually really speedy, and people like the performance too. Next slide. And in terms of thinking about alternatives to gas furnaces, heat pumps or mini splits is another thing you might hear that called, is a electric alternative that's energy efficient that can be used instead of kind of a gas heater and air conditioner. And in the last few years, kind of the range at which they're able to maintain kind of a comfortable temperature in terms of like hotter days and cooler days really has been expanding. Next slide. All right, so as a healthcare professional, what can you do? So first of all, just start asking your patients about, do they have gas appliances? Do they use gas in their homes? Probably especially patients who have respiratory conditions, but kind of given the growing developmental concerns about those exposures, patients, families as well. And, I think if you do have patients who are using gas in the home, you can talk with them about ways, potentially initially to mitigate risk through like paying more attention to, what kind of ventilation are they using? If they don't have a hood while cooking and they are using a gas stove, at least opening the window. And then, for families that are open to it or interested in it, kind of talking with them about kind of gas stove and heater replacement options. Learn about resources in your area to help with stove and heater replacement. And we'll talk about a couple of those in just a moment. And then, educate your colleagues. I know, Dr. Carroll and Dr. Caraveo echoed these sentiments, but, I'll say it as well. I think, this is something that as a pediatrician, I, hadn't been thinking about until pretty recently. So I think that, continuing, as you learn about this, bringing it up with colleagues and alerting them to the issue as well is great. Consider writing a letter to the editor for your local paper. Equally, I think the public probably is not aware of, what types of effects using gas in the home may be having on their health. And then join PSR Colorado. There's some kind of further resources on the PSR Colorado website currently about this issue, and I know we're working on getting more there as well. And then, as a PSR Colorado member, you can learn about kind of other advocacy efforts, legislative efforts that might be upcoming, and get involved in those ways too. Next slide. All right, so these are just a couple of resources just to be aware of that you could potentially refer patients to or use yourself. So Excel Energy does offer some rebates for mini split heat pumps and also ground source heat pumps. The mini split is likely going to be a more practical option for most people. I believe the Excel rebate is about $300 that they'll give people back on purchasing a mini split heat pump. Energy Outreach Colorado is a great organization that's been operating for many years around helping people, especially low-income families, improve their energy efficiency and decrease their energy bills. And for families that don't have a heat source in their home, they have started using mini splits as an energy efficient way to heat the home, and they're kind of piloting a project more specific to indoor air pollution, the Healthy Homes Project. So I think they're still working on some funding sources for that, but keep your ears open for hearing about that. I think their goal is to be able to create a program that community providers could refer to for families where there were concerns about potentially respiratory conditions and indoor air pollution, and they would kind of go into the home and work to improve the indoor air quality. Energy Resource Center is another great group in town that, again, is kind of working on energy efficiency in homes. And then, in terms of, switching to electric or induction cooking options, just checking with your local home improvement retailer is a great spot. Oftentimes, the retailer or the companies producing electric and induction cooktops will have rebates available. So good thing to let patients know about and to know about yourself. All right, so here's our contact information for anyone who does want to get more involved in this or any other issues. And I will pass it back to Cory to go through any questions that we might have.
Absolutely. Thank you, Jessica. I always learn something, even when I listen to it the second time around. We do have questions, but I'm just going to point a couple of things. I did some remodeling in my home. I moved my office to my home, and when they took out the kitchen was part of the remodel, my vent had a squirrel nest in it for my stove. Not a clue. And obviously, it wasn't working, and I had an electric stove. Now I'm shameful to have a gas stove, but that's changing. And Jane put a note in, induction cooktops. Absolutely a fun thing to do. And she said, I would never go back to anything else. I've got a little portable one like you showed there, and that's what I use. My gas stove is kind of relegated to just standing there. And another quick thing, I did a home energy audit, and the contractor, the manager that basically did this, we talked a little bit. He just is amazed when he comes into homes and does the evaluation, how many leaks there are, not just air leaving the home and lack of insulation, but the gas and other things. I mean, we have these monitors, and as you pointed out, they don't go off unless the levels go pretty darn high. And I kind of worry about chronic exposure at low level. Interesting.
Yeah.
So here's a question that Lori sent in actually in the first half. Let's see, and I just moved it down. So yes, does propane cause the same problems as gas stoves? Do gas stoves in the home give us the same pollutants as flaring at fracking wells? VOCs including benzene.
Yeah, I am just kind of, I guess, would assume that yes, you know, propane as would have similar health effects. I think, you know, fortunately, oftentimes when we're using propane, we're outside the home, so that may kind of decrease somewhat the direct effects of inhaling those pollutants. They just may be dissipated in the environment a little bit more quickly. But yeah, I think certainly it's going to contain, you know, all of those same byproducts of combustion. And then the question about the gas flare, was that, can you repeat that question?
Yeah, actually, Lori mentioned you answered a lot of the questions in your talk, but that is interesting, the flaring that occurs at fracking wells. It's almost like we're getting the same stuff that they're, well, the burning, the venting and the flaring. Flaring is when they burn the methane, and venting is when they just release it out. But I would imagine, not that, I don't know if there's any studies, but yeah, we don't have internal combustion engines. We have combustion occurring in our homes, which gives us all those things. Something we should be aware. And Heidi asked, there's a couple of these. Can we get these resources emailed to us? I think that's an absolute. Maybe Heidi can be a little more. I think what we'll have on our website are the slides that Jessica presented, so you can reference them. And there's, with the slides, there's text that kind of goes into some of the topics and the points. And there are some other resources we definitely want to make available. So on our website, psrcolorado.org, at the Healthy Electric Homes tab, we'll do our best to try to get all this information for the folks. Heidi had another question. Would PSR consider getting our legislature to require warning labels on gas stoves and heaters like California does for benzene in car emissions?
I think that's a great idea. Yeah.
Yeah, I think that the most recent Sierra Club magazine has a fascinating story on the end of oil and gas. I don't think they're going to go out without kicking and screaming. This would be a hard sell, but again, I think PSR's job is not to advocate or politicize. We're here to tell the truth. We're here, as you pointed out, if you live in a home that have these appliances, at least at a minimum, get them maintained, maintenance done. There are people that can come out and do an energy audit that can look at the efficiency or look at if the vents are working. The water heater is critical. These gas-fired water heaters have a vent that have to go out. And there's a big gap between where the top of the water heater is and the vent starts. And that's to allow for a Venturi effect to get the flow going. But sometimes the gas just pours right in the house. So I think the key, as you pointed out, is understand the risk, do what you can to not only keep your house healthy, but as a healthcare worker, somebody that's involved with other folks, spread the word. Whether we can get warning labels, I think it's an excellent thought.
Yeah, yeah.
Jessica, are you aware of any studies? Because I really was impressed with when these monitors in our home go off, it isn't in a tiny zone. It's in a big zone, and sometimes there for quite a while. I think about this because I had a couple of patients, and I'm still relatively convinced that they had long-term exposure. But is there any studies that say what are the exposures at these lower levels? Have there been any data that would say you will not maybe die from replacing or irreversibly binding the hemoglobin, but anything that would say, okay, at these lower levels, we've got a problem?
Yeah, that's a great question. I recently, in preparing for this talk, did look into that some. I was looking specifically at children when I was looking for studies. I did not find really much in terms of looking at kind of chronic low level carbon monoxide exposure. So there may be information out there. I'm not familiar with it. But I certainly think, it's something to be aware of, and certainly something that likely could use further study at this point.
Great. Jamie asked if the recording will this webinar be available. We will work on it. We know we could have it at the PSR national site, but we will figure out a way of getting it here as well. And Christian has a good comment and a question. Gas appliances require leaky buildings. Heat pumps require tight, highly insulated homes. I don't know if they require them, but they work way better. And those two items are almost mutually exclusive. Building codes drive this infrastructure. How can we stop this? That sounds like a question to a contractor or I don't know. Do you have a thought on the building codes and the difference between the heat pumps and the gas appliances? And...
Yeah, well, I mean, I think I would say certainly as we do move towards more renewable energy, you know, it just makes all the more sense, you know, to be thinking about, yeah, moving towards those two things that work synergistically together, you know, kind of energy efficient buildings and electric appliances. So I think, yeah, that's a great point that kind of the leaky buildings and gas do kind of go together, but don't really make sense for the direction that I think we're moving, you know, slowly as a state and as a global community. So. Yeah,
I mean, there is code that for the quote boiler room, mechanical room where these appliances are typically burning gas, there have to be vents that come in, typically at two sources at different locations, and yeah, it kind of destroys that whole concept in some ways of efficiency with insulation. Well, PSR Colorado is going to be well. We've been working on a video. The auditor I told about, the contractor, is going to be featured in that, and hopefully he'll be able to answer some of these questions. But I think this is a beginning on the concept of be aware that homes have potential for problems. Don't ignore that. At the same time, you know, it would be great if we could all go out and put solar panels on our house and electric appliances. But the cool thing is you could do small things. And I think one thing the contractor told me was if you do need to replace a water heater that's fired by gas, look at the electric. They are more efficient. They can be just as effective. Same thing with the induction. Have a small portable one. So even just making some small changes could hopefully make the home safer and have an efficient place. And you know, obviously the concern with the bigger picture of climate change. If we all work hard at this, it'll happen. Well, I see we're getting close to the end of the webinar, and I wish I could have a poll. I was thinking about trying to make a poll to say, hey, how are we doing? I'm very happy, and I want to thank Jessica and Yadira. Yadira had to go work on her other work, and I know Jessica's going to be probably working on some electronic files tonight. But thank you, Jessica, for the wonderful presentation and educating us and giving us not only the information to alert us of how we can ask the questions and get the information, but also give us some ideas on how to help mitigate some of the risk. On that mind, if on our website, again, I'm pointing people to that, we would love for your involvement if you're not already involved. Gosh, we'd love to have you support our cause. Monthly would be great. We're really excited at PSR Colorado because this is an opportunity for us, I do think, to make a difference in the communities, make a difference in our legislature. And boy, if we can do it with more people and more support, we would greatly appreciate it. On the website, you'll get information on the board and how to contact us. So if you have any specific issues, please give us a call, or please go there and send us messages, and we'll take care of it. Heather Bennett is our executive director, does a fabulous job, and she's always on top of things. And I want to thank Julie Morgan from PSR National, who's run this organization. So with that, Jessica, if you have any final words, now's your time. But I want to thank you and thank the attendees for participating with our first webinar.
Yeah, thank you, everyone. Hopefully you enjoyed it and learned some things and can take some action. Thanks so much.
All right, with that, we are going to close the meeting.